So when kidneys fail, it's a serious situation, but you have options. Treatment for end-stage kidney failure isn't one size fits all. Broadly, there are 3 paths to consider. Number 1, dialysis, using machines to do the work of the kidneys. And then there is conservative management, which is supportive care, and that focuses on quality of life without dialysis or transplantation. Finally, the third one is kidney transplant, and that is receiving a healthy kidney from a donor through surgery. And this is the best treatment for kidney failure in eligible patients. So let's briefly go through each one so you understand what they involve. So number 1, let's go through dialysis. For patients who want to extend their life and health when kidneys fail, dialysis is one of the main treatment options. Dialysis removes waste products and excess fluid from your blood. There are 2 primary forms of dialysis. So there's hemodialysis and there's peritoneal dialysis. Hemodialysis uses a machine and a special filter to clean your blood. Blood is drawn from your body, run through the machine to filter the waste and return to you. This is typically done 3 times a week, and each session can last about 4 hours. So some patients, however, can learn to do hemodialysis in the comfort of their own home, usually with the help of a trained partner, and this can be done more frequently. Home hemodialysis is an excellent therapy, offers more flexibility, but does require training and commitment. Another form of dialysis is called peritoneal dialysis. So if you imagine your abdominal organs like your liver, kidneys, and intestine sitting inside this big sac, the lining of the sac is called peritoneum, and that can act as your body's own natural filter to clean the blood. A small tube called a PD catheter is placed outside the sac, and it can be connected to a machine. So through this tube, a cleansing fluid is introduced into your abdomen. And as the fluid bathes the sac, waste products from your blood move into the fluid. Later, that fluid is drained out. So PD is a very gentle treatment performed daily. It offers flexibility as treatment can be done while you rest at night and you can be free during the day. No matter the type, dialysis is a life-sustaining treatment, but it's not a cure for kidney failure. It typically replaces only about 5 to 10% of your normal kidney function. This means on dialysis, you will still need to limit your fluid intake, watch your diet, especially potassium and phosphorus. Patients on dialysis feel better than they did with untreated kidney failure, but they still experience fatigue in some cases, and it can be challenging to maintain a full work schedule for some. Dialysis can also affect fertility, making it hard for women of childbearing age to conceive while on treatment. Despite these challenges, many people lead a fulfilling life on dialysis, working, spending time with family, and pursuing hobbies. I've had a patient who worked full-time as a nurse, did home dialysis, peritoneal dialysis overnight, and also sold real estate. Now she's thriving after having received a kidney transplant. I'm so proud of her. So dialysis can keep you alive and relatively well until a transplant becomes available. So let's move to the second option when you don't want dialysis or transplant. So not everyone with advanced kidney disease chooses dialysis or transplant, and that's a valid choice in certain situations. This is called conservative care. Means that instead of active replacement therapy, the focus is on managing symptoms and preserving quality of life as much as possible. This approach is sometimes chosen by patients who are older or who have multiple health issues that would make dialysis or surgery very hard on them, or by those who, after careful consideration, feel dialysis or transplant isn't aligned with their goals. It's a very personal decision, and our team is here to support patients whichever route they choose. So third option is the best option, is kidney transplantation, and that is a surgical procedure that gives you a healthy kidney from a donor to take over the work of your own failing kidneys. So here's how it works. In a transplant operation, a surgeon places the new kidney into your lower abdomen, usually on either side, right or left. They connect the artery and the vein of your new kidney to your own blood vessels, so the blood flows through the new kidney. They also connect the ureter, a tube that drains urine from the kidney to your bladder. And in most cases, your own kidneys are left in place and not removed, unless there's a medical reason to take them out. This means that after transplant, you will have 3 kidneys in your body, the 2 original ones which are not working much, and the new one that's doing its job. The surgery itself takes a few hours. Most transplant surgeries are done under general anesthesia, and you'll be in hospital for about 4 to 7 days afterward for recovery and monitoring. After a successful transplant, the new kidney takes over filtering your blood and making urine. After a transplanted kidney from a living donor will start working almost immediately in the operating room or within a day. Deceased donor may take a bit longer in some cases to wake up, also called delayed graft function, during which you may need a bit of dialysis. Once the kidney is working, you will see creatinine go down to normal or near normal levels. Now, it's important to remember that transplant is a treatment, not an instant cure-all. You will need to take medications every day to prevent rejection, and you will need regular follow-up with the transplant clinic to keep that kidney healthy. But for those who are good candidates, we often say transplant is the best gift you can receive for kidney failure, especially if it is from a living donor. So the three pathways to summarize for kidney failure are dialysis, transplant, and conservative care. For most eligible patients, living donor transplantation is the best therapy because of increased lifespan and improved quality of life.